Here we have a 2-year-old Friesian filly who had an eye injury when she got here, and she's not responding well enough to the treatment we put her on. So, and you can see the difference between the unhappy eye and the normal eye. I'm giving her a little sedation because I've got to get a little more aggressive in my exam of the eye. So we're going to give her a little bit of sedation so she's not so worried about it. Yesterday, she looked a lot more uncomfortable. The eye was more squinted. There was actually more gray in the corner yesterday, which is a sign that the cornea is unhappy. But she's been on treatment long enough where she really should be better by now. She should have looked like this 2 or 3 days after we started treating her.
Okay.
So we're just going to we're going to take a closer look and just see if there's something more, like if I have a little piece of foreign body stuck under the eyelid or something along those lines.
Yep. So you have been treating this for maybe a week?
Well, actually, no, because we started on Saturday with just we examined her last Tuesday, so 10 days.
Okay, and you would normally expect to see a little bit more progress?
A lot more within a much shorter period of time. Okay. So probably within 3 or 4 days, she would be looking normal because young horses heal fast.
Okay.
So.
And you're not seeing that?
No. So we're going to get more aggressive with our exam. That's the thing. Oh, so this is fluorescein stain. So we're putting a stain in here to show me any ulcerated corneal tissue. So we're going to see if the ulcers have healed compared to what we saw last week.
Okay.
So remember, we had that little line that it absorbed down in the corner, which looks pretty good. Oh, that looks better. There's no uptake there. This is interesting. So I'm seeing less stain uptake, but what I got to do is I've got to reach under this little third eyelid where that pool is.
Yeah.
But this is a local anesthetic called carbocaine or mepivacaine. We're going to block her nerve so she can't blink. So this is kind of similar to what a dentist does when they're doing a block for working on your teeth. We're going to block the nerve. Now she might not like this, so just there may be a little wear. So we're just infiltrating the supraorbital nerve to get it so she can't close her lid, so I can do a better job looking around in there for any foreign bodies. So right now we're going to put a local in so she won't feel anything on the surface of her eye.
Okay.
So because we got to do a little exploring. So this is going to be like a little shoot. There we go. She is so good. Let's look under here first. So what we're doing is we're looking for plants, grass on, timothy, anything that's in there. Yeah. So what we're trying to do now is just get her, the surface of the eye anesthetized enough so I can probe under the third eyelid and just make sure there's nothing under there that's going to be a problem. There we go. There we go. I know, you're doing great. So we're looking, oh, this is so cool. Jamie. That's under the third eyelid, okay? That's where we'd be looking for a grass on. And then I'm just going to look at where we stained. And that is doing a lot better. So there's no foreign body that I can see. I think it just, for some reason, I'm not sure why, she changed so dramatically overnight. So we're going to start her on a med that's going to dilate her pupil, which will make the eye more comfortable, but it also makes it more sensitive to light. So we're going to put a little tape over a fly mask so that it acts like a visor. So we took 5 tubes of blood from her yesterday. We separated it, we spun it down. This is serum from her blood, which tends to stop some of the degradative processes in ulcers, and it makes them more prone to healing faster. So we'll start around what are called serum tears. We're going to put some tears made from her serum in the eye to act as part of her therapy. Of course, now she's easy to treat because she doesn't feel anything.
Right.
She's sedated, everything's blocked.
And we'll be doing this for a couple days?
Yeah, well, at least 3 or 4 more days. So with people like drops, right, for their eyes because we just drop them in. But we like ointments for horses because you're treating a vertical surface, right? So drops, unless you have a really cooperative patient, which she's been good. You got to actually pull that lower lid down so you get a drop in, right? Or you're shooting it in, right? Which they don't like. That scares them. Right. But then when you turn around and use an ointment for a treatment, it's much easier because you're putting it against a vertical surface. Like I'm going to give her some ointment right now. How this goes right in the corner. Let's get this moving. There we go. And this is, so we're just going to tuck it in there like that. Much. And I'm going to cheat and just rub it in there.
Okay.
On that side. And we'll just see if she continues to hopefully keep turning the corner like this.